back and thanks for joining us today. I'm Marissa Lennox and you are tuned in to the National Vaccine Summit presented by C.A.R.P.
I'm Natasha Ray and you're tuned into the final session of the day. All day long we've been hearing about the importance of vaccines and the connection between immunizations and our well-being and the well-being of those we love.
We're starting this session off with a story by Joy TV's Dean Otwell. He took to the streets to find out how Canadians on the West Coast are feeling about the COVID-19 vaccine rollout. Let's take a look.
No, I can hardly wait to get mine, and I just took my mom the other day, so I'm good with it. I'll take whatever they give me. Yeah, you know, why not? Yeah, let's get it over with and behind us and get life back to normal.
Well, here on the West Coast in British Columbia, we're in phase 2 of our vaccination rollout plan, targeting our eldest Canadians. Recently, that was expanded to include general population priority groups, including those in manufacturing, grocery store workers, and kindergarten to grade 12 educational staff.
Yeah, I work at a school, so I'll get one before in April. Well, because it's a vaccine, you don't know what you're putting in your body. But I think you have to balance what the COVID could do to you too.
I got vaccinated. I live in a recovery house, so we all got a chance to be able to get ours. I want this stuff to be done and over with. That's pretty much it.
Reactions on receiving the vaccine remain mixed.
I mean, some people, most people, I believe, maybe 70% of the people are for it. I think there are many who have, maybe a fear that if they took the vaccine shot, they are going to have COVID-like symptoms.
And I'll just give you a sticky to put on your dash there, okay?
You know, it seems very rushed, so there is a concern on that. But yeah, if I could travel without it, I'd seriously think about not having it. If I can travel with it, then I'd have it.
621.
I think it's great. It'll be great to have herd immunity and be able to get back to some sense of normal. However, I am apprehensive about the AstraZeneca one. I have 2 at-risk family members, one in long-term care and one with an immune deficiency. So I want the best protection that I can get, so to protect my family and my loved ones.
British Columbia hopes to have every eligible Canadian vaccinated here in the province by July the 1st. Dean Otwell, Joy Television.
Thanks, Dean. I'm sure the feelings echoed in this story are universal across the country and perhaps even around the world. Now, on to our guest, Dr. Shelly McNeil, who will both provide us with a talk and then answer your most pressing questions.
Dr. McNeil is the chief of the Division of Infectious Diseases at Dalhousie University, the deputy head of the Department of Medicine at Dalhousie, and deputy director of the Canadian Centre for Vaccinology. Today, Dr. McNeil is here to share a talk on what we need to know about COVID-19 vaccines. Her talk will be followed up with some questions we received from you, our at-home audience. Welcome, Dr. McNeil. Great to have you.
Thanks very much. Thanks so much for having me. It's a pleasure to be here today. This is an exciting time, obviously, in the world of an infectious disease specialist or a vaccine expert such as myself as we roll out really one of the most ambitious and exciting vaccine campaigns at least in my lifetime, perhaps not in all of your lifetimes. So I wanted to take a few minutes. I'm not going to use slides. I just wanted to take a few minutes to talk to you about Canada's vaccine program and the vaccines that are available. And then afterwards, as Marissa said, I'll try to answer as many of your questions as I can. So Canada is, as you know, in the process of rolling out vaccines to as many Canadians as possible, as quickly as possible, with the overarching goal of preventing illness, hospitalization, and death due to COVID-19. We have had an unprecedented collaboration or cooperation around the world between scientists and both those in the vaccine industry, manufacturers, and in the private sector, universities, and the like. And this has allowed the development of really some of the best vaccines we've ever used for any disease in relatively short order. So we now have in Canada 3 vaccines that we're currently using and that are available and being used in all, I think, pretty much everywhere in the country, and more soon to come. Canada, like many countries, obviously recognized that we would need to be in line to be able to purchase vaccines quickly once they became available, and once groups like Health Canada and the National Advisory Committee on Immunization had a chance to review the safety and how well the vaccines work. So Canada had the foresight to make what they call pre-purchase agreements, or to buy vaccines that were anticipated to be coming down the pipeline, so that very quickly after the vaccines were proven to be safe and effective, Canada would be able to get some access to those vaccines and give them to the Canadian population quickly. So as I mentioned, we have 3 vaccines. You probably have heard about all of them at least a little bit. So there are 2 vaccines that use the same type of technology or work in similar ways. Those come from Pfizer and Moderna, and we commonly call them Pfizer and Moderna vaccine. And they are what we call mRNA vaccines. So that stands for messenger RNA. These vaccines are pretty smart. They are new type of vaccines that we've not used before. And rather than take a piece of the coronavirus, have to grow up the coronavirus in the lab and then take a piece of it and give that to the body to teach it to recognize coronavirus should someone get infected, these vaccines use a small section of sort of man-made mRNA or messenger RNA, which is effectively just a recipe card that teaches our own cells in our body to make antibodies and other immune responses against something called the spike protein. And the spike protein is a little protein on the surface of the coronavirus that's really important to the virus because it allows the virus to bind to the cells in the human body, enter the cells, and cause infection. So if we can teach the body to recognize that spike protein, then it binds that spike protein and prevents the virus from being able to set up shop, prevents it from being able to bind, to infect, and thereby reduces the risk of it causing infection or disease. So those are the mRNA vaccines. They are not live vaccines. They don't contain any coronavirus itself, so it's not possible for them to cause COVID disease, but they do stimulate a really nice response against COVID that protects people when they're later exposed to COVID down the line. Though the AstraZeneca vaccine, which is the 3rd vaccine, is what's called a viral vector vaccine. It's also a newish vaccine, although we have used it for some other diseases in the world, but it's not been used in lots of different vaccines in the past. And this is also not a live vaccine. So it uses a virus called an adenovirus, which is a cold virus that's been modified so that cold virus can't replicate, it can't grow in the body, it can't cause disease, but it also contains the genetic material that teaches our body how to make antibodies and other immune responses against the spike protein in a similar way that the mRNA vaccines do. So these vaccines are all very, very effective. Again, they're amongst the best vaccines we have. Interestingly, they work better than, say, the influenza vaccine, which we know has dramatic benefits every year in healthcare providers, as I think Dr. Chu was just talking to you about. So these vaccines work better than that. The mRNA vaccines have been tested in thousands of people and now given to millions of people around the world. So that would be Pfizer and Moderna. And they've been shown to be over 95% protective against symptomatic, so COVID disease associated with symptoms, and almost 100% of the time do they prevent hospitalization or death in someone who's been infected with COVID. The AstraZeneca vaccine as well is very effective. It perhaps is not quite as effective as the mRNA vaccines, although we're getting more and more information as we're starting to use that vaccine around the world to suggest that it's close to as effective, particularly if we're talking about prevention of hospitalization and death. So the AstraZeneca vaccine is about 82% effective compared to about 94 or 95% for the prevention of COVID disease when the doses are given 12 weeks or more apart, so 3 months apart. So pretty close and not worth splitting hairs about. Again, the goal of these vaccines is to prevent hospitalization and death, and all three of these vaccines do that very, very well. The interval between the vaccines is a topic of some discussion, as you've seen in the news. And there's a balance between being sort of struck in Canada between trying to maximize the number of people who are protected while getting both doses delivered as soon as possible. So as the vaccines have been rolled out around the world, it's clear that there's very good efficacy or effectiveness in preventing COVID from that first dose. And we know that in the clinical trials of the mRNA, the Pfizer and Moderna vaccine, that protection lasts at least 2 months. But in the real world, we now have data emerging from Israel, from the United Kingdom, and even from British Columbia and Quebec that shows that the protection from that first dose is very, very good, above 80%, and lasts at least 2 months in most of those studies, and at least 3 months now coming out of the United Kingdom, to suggest that we really don't see any drop off in the effectiveness of the vaccine at 2 months or even 3 months. And it would be very unusual, of course, to see the vaccine, protect 80% and then just stop working. So based on that, the National Advisory Committee on Immunization, trying to balance getting as many people in the community protected from that first dose as possible, has recommended that it's okay to extend the interval between all of these vaccines by up to 4 months. And many provinces are in fact doing that. With respect to the safety of the vaccines, again, they are all reviewed by regulatory bodies like Health Canada and others around the world. And all of those bodies look at all of the evidence that's available to them, both from the clinical trials and from the rollout of the vaccines around the world, to make sure that there's no safety concerns being seen. They are remarkably safe vaccines, but you can expect that because the vaccines work so well to stimulate the immune system, that's associated with some inflammation in the body around the time of that we give the vaccine. So it's very common with all three of these vaccines, particularly after the second dose, but sometimes after the first dose, to have a very sore arm. It might be red, hot, swollen, tender, sometimes a bit itchy. That is just a usual, normal response to the vaccine and expected to happen in many, many people. Sometimes that's a little bit worse after the second dose. And sometimes people feel a little bit generally unwell after the dose, again, as the immune system responds to the vaccine. So you might have headache and feel a bit tired. Sometimes people have a little bit of a fever. About 10% of people will get a fever, nausea, vomiting, sort of tiredness. But again, these are fairly mild. They usually don't interfere too much with people's usual activities, and they just last a day or two. So on balance, we know we have this great vaccine that causes a great deal of protection, but that is balanced by a little bit of side effects. At the time, you can take Tylenol or Advil, use cold compresses on your arm. All of those things are fine and don't impact how well the vaccine works. We don't know how long the vaccine will work for, of course. It's a brand new vaccine, so we'll be following that. And of course, you can imagine that most vaccine scientists and governments and companies around the world are watching both the safety and how well the vaccine works as we give it to millions of people around the world, and looking to see if we do start to see that the vaccine isn't working. Many people ask, will this be a seasonal vaccine? Will I need to get a booster, or will I need even to get a booster every year? And we really just don't know that yet. So we're waiting to find that out. But the take home message here is, the speed with which these vaccines was developed was not because any shortcuts were taken. It was because there was an unprecedented cooperation between governments and academics and companies that make vaccines to allow everybody to direct all of their energy and all of their resources and all of their very smart vaccine development brains on a single problem. And this is what can happen when the world comes together to do that. So the result of that is these three terrific vaccines that work very well. And when you get the opportunity to get them, I hope you'll go out and get whichever one you can, because we know that they will save lives, and they have been saving lives around the world. world. So maybe I'll stop there, and I'm happy to take your questions.
Thank you, Dr. McNeil. That was very insightful. Now, before we start taking questions from our audience, I know Natasha and I have a few of our own. The first question I wanted to ask you about was whether or not you can be a carrier of the virus post-vaccination. What do we know there?
Yeah, so that's a topic of much study still. We know that the vaccines, all of these vaccines, dramatically reduce the risk of being a carrier. Again, they bind to that spike protein, so they prevent the virus from attaching and getting into cells. We don't know that they will do that 100% of the time. In fact, they probably don't do that 100% of the time, which is why we're encouraging people to continue to wear masks and do physical distancing and wash your hands, because until most people are protected by immunization, we don't want that small proportion of people who might be vaccinated not get sick, be able to transmit the virus.
All right, and what do we know about, do vaccines provide better immunity than the immune response you would get from getting the actual virus? In other words, if you've had the virus, do you also need to get the vaccine?
Yeah, we certainly know that people can be reinfected with coronavirus after a naturally occurring infection, and that does not appear to be the case, at least in terms of symptomatic infection after vaccine. So we don't know how long protection after a naturally occurring infection lasts. So we do strongly encourage people, even if they've had a lab confirmed or suspected case of COVID, to go ahead and get the vaccine.
Thank you.
Thank you, Dr. McNeil. I just wanted to go back to when you spoke about how fast the timeline was for the creation of the vaccines. And I read a quote once that talked about how the mRNA vaccines were created on the shoulders of giants, which means there was about 20 or so years of research around mRNA vaccines. Could you speak a little bit to that? Because I know a lot of the vaccine hesitancy has come from the speed at which these vaccines appeared.
Yeah, so mRNA, the idea of mRNA vaccines and even the testing of mRNA vaccines is not a new concept. There's been people working on mRNA vaccines for many, many years. Most of them were actually being developed as treatments for cancer as opposed to infection prevention vaccines. But the technology's been around for a very long time, and we knew that it was very successful in causing the immune system to respond. So it was a natural way to try to prevent COVID that would be able to be manufactured very quickly in large amounts, which we knew we would need to end this pandemic.
Thank you. So now let's get to some audience questions. First up, we have Robert from Burlington, Ontario, with a question about virus transmission. Go ahead, Robert.
My name is Robert Groza. I am 65 years old. I was a technician for many years, retired now, living in Burlington, Ontario. Why is the vaccine able to stop the transmission of the virus? And can you explain how this works?
Dr.
Thanks,
McNeil,
Robert.
over to you.
Oh, sorry. So as I was mentioning, I think to Natasha, the vaccine works by creating antibodies and other cells that recognize the virus and block its entry into cells. So the virus can't infect if it can't get into cells. So by making those antibodies, some of which are in the nose and throat and lungs, it really can avoid most opportunity for the virus to bind. And therefore, we know that the mRNA vaccines, and we're having emerging evidence that the AstraZeneca vaccine can prevent onward transmission, but we just need to know exactly how well that works. And so we all keep following the rules for now until everyone's vaccinated.
All right, our next question comes to us from Nancy in Toronto.
Hi, my name is Nancy Milani. I am 59 years old. I am currently not working. Most recently was vice president of a trade show company. And my question for you is, how long will the vaccine be effective? And will I need to get a booster shot down the road?
Dr. McNeil.
Thanks, Nancy. So that is a topic we are all following avidly. We don't have long-term data to know how long the vaccine will work. And of course, that's true with any new vaccine. We don't know until it's been out there for a while how well it works. But what we do to test that is we watch people who are vaccinated and people who are not vaccinated. We watch to see when we start to see cases in vaccinated people. And that gives us a sense how long it works and whether we need a booster. So we'll all be watching that carefully.
Thank you, Dr. McNeil. Next up, we have David from Vancouver with a question about clinical evidence supporting the second dose 4-month delay.
Hi, I'm David Hay. I'm from Vancouver. I'm 57, and I'm a salesman with Levy Show Service. My question is, what clinical evidence do you have that justifies the Pfizer vaccine second dose being postponed by 4 months?
Thanks for that question, David. So there is a fair amount of evidence emerging about that question, and lots of scientists and vaccine researchers and public health people are following that. Again, some of it comes from clinical trials where we know that out to about 2 months we have effectiveness of that first dose. But as the vaccine's being rolled out around the world, particularly in the United Kingdom, we can start to see how long protection from that dose lasts. And the National Advisory Committee on Immunization is balancing, getting as much population level protection as possible by getting first dose into people as quickly as possible against that duration of protection from the first dose, and following that evidence as we go. It may be that there are some people in which we should be shortening that interval, and we're looking at that data coming out from all places all around the world to try to answer that question. But it really does come from the real world use of the vaccine in many areas of the world that we feel confident in this interval for most people.
Thank you, Dr. McNeil. Next, Willoughby from Toronto has a question about those who experience anaphylactic shock.
Hi, my name is Willoughby Edwards. I'm 85. I live in Toronto, and I'm retired, previously president and CEO of C.A.R.P Marketing Corporation. I have a question about the protection for those of us. There are hundreds of thousands of us who are subject to anaphylactic shock. And all of the literature from all of the vaccine manufacturers that I have found on the internet specify they actually have an alert, a vaccine alert, which specifies that those of us in this condition are not, and they have it in uppercase actually, to take the vaccine. So my question is, what happens to those of us who don't take the vaccine? Is there ever going to be any product made? Is there going to be another vaccine made for those of us subject to anaphylactic shock, or not? How do we get protected?
Yeah, thanks for that question. Like with any vaccines, all of these vaccines have some components that very, very, very rarely can be associated with severe allergic reactions, although the components in the vaccines that do that are uncommonly associated with anaphylaxis. And in fact, we do vaccinate people with a history of anaphylaxis all the time with these vaccines. We just don't vaccinate them if they are known to have anaphylaxis to those particular components of the vaccine or had trouble with the first dose. So all of our clinics are prepared to treat anaphylaxis should it happen. The nurses are all well trained. And as long as people haven't had anaphylaxis to the vaccine, most of us as experts who help with the clinics will allow them to be vaccinated. We just watch people a little bit longer, and the vast majority of people can be safely vaccinated. If people have an allergy to one particular vaccine, the component in one particular vaccine, of course, now we have 3 to choose from, so we can choose carefully. But if you're allergic to shellfish or bee stings or other foods or oral medications, none of those are a problem with these vaccines. If you've had anaphylaxis to an injectable medication or another vaccine, then you should definitely speak to your healthcare provider about that before, just to make sure it's safe for you to get these vaccines.
Thank you. And now Mignonette from Mississauga has a question about vaccine options. Go ahead, Mignonette.
My name is Mignonette. I am 64 years old. I live in Mississauga. I am retired. I used to work at FedEx office before my retirement. For seniors, is it a better option for them to have the Moderna or Pfizer vaccine rather than the AstraZeneca vaccine?
Thanks for that question. So all of these vaccines, as I said, work very well in people under and over the age of 65. But because we have better information on larger numbers of older people with the mRNA vaccines, the National Advisory Committee has said that we should prioritize the mRNA vaccines for people at the highest risk. So that would include people in nursing homes, older people who are at high risk of disease. But that being said, the National Advisory Committee also clearly says that if you should get whichever vaccine you can get if there's a shortage of vaccine. So if you're offered AstraZeneca, absolutely get it. It is a great vaccine in terms of preventing hospitalization and death. If you're in an older adult population, as we sort of roll things out and there's more mRNA vaccines around, you might consider getting that one instead.
All right, our next question comes to us from Don in Toronto. He wants to know more information about vaccine passports. We've all heard so much about those.
Hi, I'm Don Letty. I'm 54 years old. I'm in sales. My question is, what is vaccine passport and how will it be used?
Thanks for that. So a vaccine passport really is just an immunization record, like you might have had with your little yellow card from when you were a kid that documents that you've had both, in this case, both doses of the COVID vaccine or one or both doses of the COVID vaccine. How it will be used is not clear and will really vary around the world. So some countries may require proof of vaccination to let people into a country. Some resorts may require it. Some airlines may require it. In Canada, we have not yet seen anyone using this proof of vaccination or vaccine passport to make different rules for vaccinated versus unvaccinated people. But time will tell how private businesses, countries, et cetera, use this proof of vaccine. The short answer is right now, we're not in Canada managing people who are vaccinated any differently than people who are not vaccinated. We want people to follow all the same rules. We give, people can work, people can go to school, et cetera, irrespective of their vaccine status. But it is important to hold on to your proof of vaccination because over time, as more and more people are vaccinated, it may be important in various situations to prove you've been vaccinated.
And Don has a follow-up question. Don, go ahead.
Is it possible to have a cold and flu at the same time as having one of the COVID variants? How would doctors recognize this and treat it?
So, yeah, I suppose it's possible. I think maybe not so much that they have them at the same time, but a mild COVID infection, whether it's with a regular COVID virus or one of these variant COVID viruses, may be indistinguishable in terms of the symptoms between that and a regular cold virus, for example. So I think we will continue to test people. We want you to come out and get tested if you develop cold symptoms, because we do want to be sure you don't have COVID as opposed to another virus, because we want to, of course, reduce the risk of you transmitting that. So anyone who has even mild symptoms, most of the country now you can access testing. Please make it part of your routine that you stay home if you have a cold or flu, recognizing it could be cold or flu or COVID, but could be transmitted, and make sure you go get tested if you're able to.
Great insight and reminder, Dr. McNeil, that if you have any flu-like symptoms, you should get tested for COVID. Our next question is from Robert of Richmond Hill. Robert, go ahead.
Hi, my name is Robert Halaz. I'm 58 years old. I'm from Richmond Hill, and I'm a director of sales in the trade show industry. And my question is, what is the efficacy of the Moderna Pfizer vaccine at 4 months prior to the second shot?
Thanks very much. So we've talked a bit about that. And again, we don't have data all the way out to 4 months, but in the real world, particularly the United Kingdom, we're now out into 3 months or so, showing efficacy in the 80 to 85% range for that first dose. And we're following that closely to make sure that it extends out to the 4 months, but we're pretty confident it will, because again, it would be pretty unusual to see a sudden lack of effectiveness all of a sudden at 4 months versus 3 months.
All right, our next question is from Ramona from Surrey, BC, who's asking about the timing and combination of the COVID vaccine with other adult immunizations. Go ahead, Ramona.
Hello, my name is Ramona Captain. I live in White Rock, Surrey, British Columbia. And my question is, I just got a pneumococcal and a vaccine for shingles. I went back to get the second dose, and the pharmacist told me that I should not get the second dose because I would be getting the COVID vaccine and I should wait. But I'm not sure how long I should wait. I think I will be getting my COVID vaccine fairly soon, but how long should I wait after that to get the pneumococcal and the shingles?
Great, thanks. So generally, we're recommending that people not get any vaccines within 2 weeks before getting their COVID vaccine. So in the case of shingles vaccine, for example, it's perfectly fine to extend the interval between the 2 doses of shingles vaccine. And that's similar to the principle where we think it's probably okay to extend the interval with COVID vaccines. But I would hold off on any vaccine that's not critical at this moment if your if your age group is about to come up, because we will want to defer the vaccine, really just to avoid confusing side effects, say to the shingles vaccine and the COVID vaccine. We will want you to wait 2 weeks after you get that any other vaccine. And once you've had your COVID vaccine, wait 4 weeks after, just to give the COVID vaccine a chance to work before you have another vaccine. But for most vaccines, waiting for now, if it's not a vaccine that you need for some specific reason right this moment, and you know you're about to be eligible for COVID vaccine, the advice you were given is pretty reasonable. Just hold off, get your COVID vaccine, and then a month after that, go ahead and get the other vaccine.
Great point, Dr. McNeil. Our next question is from Scott in Toronto. Scott, go ahead.
My name is Scott Latham. I'm 52 years old. I'm from Burlington, Ontario, and I'm a video technician. My question is, do the different vaccines have different interactions with pre-existing medical conditions?
So that's a different question. So all of these vaccines are safe in people with underlying medical conditions. We don't have specific safety information or effectiveness information about how well vaccines work in every single type of underlying medical problem. So for example, in people who don't have a normal functioning immune system, or people who have underlying autoimmune conditions, these vaccines haven't widely been tested in those groups. But because the risk of COVID is high in those populations, we absolutely recommend the vaccine for those people. We don't know for sure it will work quite as well as in people whose immune system is normal, for example, but these are great vaccines, and other vaccines would tell us that there might be slightly less effectiveness, but it's still likely to offer considerable benefit. So if you have underlying medical problems and you're not sure if you should get the vaccine, the answer is almost always yes. But it's a good idea to talk now to your healthcare provider, get your questions answered so that when you do get the chance to be vaccinated, you don't have to scramble to try to get to your doctor to ask your questions. So reach out now. Doctors are all receiving calls every day just to make sure people are comfortable and have the information they need to make a decision. But there are almost no groups of patients we would not give these vaccines to as a general rule.
Thank you so much, Dr. McNeil. We appreciate you sharing your insights with us today. What do you think was the take home for you from everything Dr. McNeil talked about?
Well, there were some great questions from all of our, the members from our audience who asked those awesome questions, particularly around vaccine hesitancy. I think what was so important that came from Dr. McNeil was that these vaccines are safe, and the best vaccine is the one that's available to you first. And I can tell you, Natasha, I, for one, am really looking forward to getting my shot.
Yeah, I'm looking forward to the world getting back to the way it was. So we had some really great questions come in for Dr. McNeil.
Yes, absolutely. And while we only had a handful of people join us today by video and ask their questions, I'm sure for every person there are dozens watching who have the exact same questions. So thank you at home for joining us today at the National Vaccine Summit. For more up-to-date information on the vaccine rollout, the latest in healthcare, legislation, and financial security, visit us at CARP.ca.
Thank you for joining us. We hope your questions have been answered and you have a clearer understanding of the importance of vaccines and your health. From Vancouver, BC, I'm Natasha Ray. See you soon and take care.
Signing off from the Zoomerplex in Toronto, I'm Marissa Lennox. Until we see you again, take care and be well.